Okay, sir.
And Samya, speak slowly, please.
Okay, sir.
Okay.
Okay,
And
And near to mic.
yes,
okay, sir.
yes.
Today I am here to talk to you about informed consent of donor and recipient of BMT.
Samya, I didn't understand. Sorry, can you repeat?
So today my topic for presentation is informed consent of donor and recipient of BMT.
Yes, yes, yes.
These are all learning objectives.
Okay.
I will cover these learning objectives in next slide. So what is informed consent? Informed consent is process by which a fully informed patient can participate in choices about his or her healthcare. We can also define it. The process by which a healthcare provider educates a patient about the risks, benefits, and alternative of a given procedure or intervention. The patient and guardian must be competent to make a voluntary decision, and informed consent is both an ethical and legal obligation of medical practitioners. So next point of informed consent is principles. There are few basic principles which we need to remember. The first principle of informed consent, patient and donor or their legal guardian must have better decision-making capacity, and they must be given sufficient time for careful decision-making. Number two, medical provider must disclose information of the treatment, test, or procedure, and in question including the expected benefits and risk and probability of their occurrence. Families have right to review the test and have right to obtain the reports of their test. The third principle of informed consent is patient and donor are their legal guardian, understand and comprehend the relevant information. Patient need relevant information to be shared in a way that they can easily understand and easily retain. The fourth principle of informed consent is they should be given the opportunity to ask questions and to have these questions answered to their satisfaction. Number 5, it's very important that the patient and donor or their legal guardian voluntarily grant consent without any coercion or duress. Yes. Next point is types of informed consent. There are 3 types of informed consent: written consent, verbal consent, and implied consent. The most important type of informed consent is written consent. When our agreement is given by signing a document for a treatment or procedure that is complex and carry higher risk. So move on to the next point, that is documentation of informed consent. Informed consent form basically is a legal document that ensure an ongoing communication process between patient or their legal guardian and healthcare provider. It also implies that healthcare provider has given information about patient condition and treatment option, and that patient and guardian have used this information to choose the treatment option. So move on to the next point, that is language of consent form. Language of consent form should be readable, should be appropriate to the population and culture, should be understandable, And in consent form, we should limit medical terminology and avoid informal or slang speech. So, who can give consent? Adult patient and donor can give consent for themselves, and also legal representative in case of minor or person who is incapacitated. And legal representative could be natural or adoptive parents, legal custodian or guardian, and person having power of attorney to provide medical consent. Next is process of informed consent, that is complex and start with the assessment of decision-making capacity of a person from whom we are taking consent. This capacity means the ability to use and understand the information to make a decision and communicate that by decision. A person lacks capacity if their mind is impaired or disturbed in some way. For example, mental health condition, brain damage, physical or mental condition, and intoxication. Second point of process of informed consent is disclosure of information. After this, as per basic rule of informed consent, we have to disclose complete information about the treatment. And informed consent must include
Got some things that was not mentioned. Once it be get the getting will be put in place. Yes, the problem is laying down.
informed consent must include information on risk and benefits of the procedure, information on protection of medical information and confidentiality, information on the need for follow-up, and alternate treatment available. And the second part in the disclosure of information is the health professional must confirm that donor have understood the information provided, had an opportunity to ask questions, and confirm that all the information they provided is true to the best of their knowledge and documented in the medical record. So the last point of process of informed consent is documentation. That is very important. Once the consent is secured, signature of the collection physician on having reviewed consent must be obtained, as well as the signature of participant or legally authorized representative or their guardian. In case of verbal consent, the clinic note must detail discussion of the protocol, including the documentation of required element consistent with institutional policy and applicable laws and regulations. And in case of failure to obtain informed consent, should also be documented along with its reasons. So what is informed consent according to FACT-JCI, International Standard for Hematopoietic Cellular Therapy? It is basically a clinical program that established and maintained policies or procedures addressing in donor and recipient informed consent. And clinical program director and attending physician shall have received specific training and maintain competency in donor and recipient informed consent. Important point of informed consent is allogenic and autologous donor information and consent to donate. The first point of allogenic and autologous donor information is the collection procedure shall be explained in terms the donor can understand and shall include the risk and benefits of the procedure, test and procedure, and rights of the donor to review that result of the test, and alternative collection method, protection of medical information, and confidentiality. The donor must have the opportunity and be encouraged to ask all questions he or she feel necessary, and detailed, accurate, and non-coercive answer given. Second point of that is interpretation and translation shall be performed by qualified to provide these services in the clinical setting. not by the family member, and legally authorized representative serve as the interpreter or translator. And the donor shall have an opportunity to ask questions and have right to refuse to donate. And also explain to donor that the potential consequences to recipient of such refusal. Donor informed consent shall be obtained and documented by a licensed healthcare, not by the primary healthcare professional overseeing care of the recipient. In case of minor donor, informed consent from the donor's legally authorized representative. And the allogenic donor shall give informed consent prior to the release of the donor egg or before the procedure or treatment start. The donor shall be informed of the policy for cellular therapy product, discard or disposal, including actions taken when an intended recipient no longer requires the cellular therapy product. And documentation of consent shall be available to the collection facility staff prior to the collection procedure. Last point of allogenic and autologous donor information and consent to donate, that is very important. The use of an ineligible allogenic donor or an allogenic donor for whom donor eligibility determination is incomplete shall require documentation of the rationale why he or her selected by the transplant physician, and urgent medical need documentation and informed consent of the donor and the recipient. Last topic of my presentation is nursing role. That is very important. Nursing role in informed consent are limited. Physician is responsible for the informed consent, but the nurse must ensure that the all aspects of an informed consent are closed. Document the fact that this has already been performed by the physician and patient has already consented to allow the physician to conduct the procedure. The nurse is competent and capable of taking form of patient and witnessing the patient sign the form. The nurse should make sure that the physician has properly explained the procedure, risk, and alternative to the patient. And the nurse also encourage communication with the patient in order to determine if the patient understands the treatment or not. And if the nurse suspects that the patient doesn't understand the information or doesn't understand the treatment, the nurse should notify the physician, and physician should return and speak with the patient again. The nurse shouldn't attempt to answer medical question regarding these matter in order to get the patient signature on a form. So that's the end of my presentation. Thank you all for listening.
Thank you, Samya.
Thank you, sir.
Okay, so are there any questions? Anybody wants to add anything or ask for clarifications?